Alright, your boy Knowledge with Knowledge, Universally Alkaline, Natural Health, Wellness, and Herbal Remedies. We're back with part 2 of Crohn disease. I had to move to another location. I got a little wet. That's alright, ain't nothing wrong with a little good rain. But we covered herbs. Did herbs real quick, like. So recommendations for helping yourself uh, treat, well, not necessarily treat Crohn's disease because there's no cure for Crohn's, but you can get it to a point to where it doesn't bother you, it goes in remission. So, I'm sorry, I had to run to move to another location, so I'm gonna end it, man. It feels so good out here. Recommendations: eat a diet consisting mainly of non-acidic, fresh or cooked vegetables such as broccoli, Brussels sprouts, cabbage, carrots, celery, garlic, kale, spinach, and turnips. Steam them, boil them, or bake them. Bake them. Drink plenty of fluids such as steam distilled water, herbal teas, and fresh juices. Fresh cabbage juice is very beneficial if you have Crohn's. Just to put that out there. Excuse me. Get some stuff situated. Add papaya to your diet. Chew a couple of the seeds, and that will also help aid in digestion, so you don't have those digestive problems. During an acute attack, eat organic baby foods, steamed vegetables, as well as cooked brown rice, millet, and oatmeal. Try eliminating all dairy. This includes cheese, fish, hard sausage, pickled cabbage, and yeast products. Eliminate from your diet, and see if the symptoms that you have will improve. You're gonna have to go through a process of elimination to know what's going to cause your Crohn's to become inflamed or not. These foods are high in histamine. Many people with Crohn's disease are histamine intolerant, so milk and other dairy products contains carrageenan, which is a compound extracted from red seaweed. Carrageenan, which is widely used in food and industry for its ability to stabilize milk proteins, has been shown to induce ulcerative colitis in lab tests in animals. Also, avoid alcohol, caffeine, carbonated beverages, chocolate, corn, nuts, popcorn, eggs, any food that has artificial additives and preservatives in it, fried and greasy foods, margarine, meat, dairy products such as milk and cheese, pepper, spicy foods, tobacco, white flour, and all animal products. All animal products, if you got Crohn's, listen to me. Pretty much you're going to have to take up being a very, very strict vegetarian with no dairy in your diet, or you're going to end up going all the way vegan. With the exception of white fish from clear waters. These foods that I just named off are irritating to the digestive tract. Mucus forming foods such as processed and refined foods and dairy products should also be avoided. Limit your intake of barley, rye, and wheat or wheat products. You're going to have to read labels and all that if you want to keep your guts. Like, that's just my way, the simple way of me saying it. You want to keep your guts intact and not have to deal with the surgery and have part of your intestines taken out, please heed to what I'm telling you. I'm giving you this information for a reason. Avoid refined carbohydrates. Do not consume such foods such as boxed dry cereals or anything that contains any form of sugar. Diets high in refined carbohydrates have been associated with Crohn's disease. These foods must be eliminated from the diet. You're going to also have to check your stool daily for bleeding. Also, as much as possible, avoid stress. You got to learn to manage your stress. Our thoughts, nervous system, and bodily functions are deeply interconnected, you dig? So, rest is very, very important, especially when you have those attacks where you're inflamed. Make sure the bowels move daily. Make sure the bowels move daily. Do not use harsh laxatives. Gentle enemas may be made using a drop full of alcohol-free herbal extract and 1 teaspoon of non-dairy acidophilus powder to 2 quarts of lukewarm water, which is good. Just screw the video up. There we go. It timed out. Sorry about that, people. Accumulations of toxic body waste often become breeding grounds for parasitic infestation. Toxins can also be absorbed into the bloodstream through the colon wall. So, psyllium husk, PSYLLIUM, just in case you want to look for it, husk, should be used daily to add fiber to the diet. That is another thing. We need fiber in our diet. So, once again, psyllium husk should be used daily to add fiber to the diet. This aids in removing the toxins before they are absorbed. Note, always take supplemental fibers separately from your other supplements and if you're on medications as well. Do not use rectal suppositories. They contain high hydrogenated chemical prepared fats. If you are constipated, use a cleansing enema. Also use a heating pad to reduce abdominal pain during those inflammations. Some things to consider. There is no constant dietary rules that apply to everyone, but living with Crohn's disease, people who live with Crohn's disease are generally encouraged to eat a healthy diet to help the body replace the lost nutrients. Moreover, some nutrients such as essential fatty acids and amino acid glutamine has been shown to help maintain a state of remission. I'm going to say it again. Some nutrients such as essential fatty acids, like I keep saying, white fish contains omega-3, omega-6s, and they have your essential fatty acids. Also, your amino acid glutamine. Those two have been shown to help keep Crohn's in a state of remission. However, one study shows that using 4 grams of fish oil, up to 80% omega-3s per day, had no effect over 1 year's time on people who were in remission from Crohn's disease. It's possible that the dose wasn't large enough to affect the study as well done as it was done, but it included nearly 400 patients from around the world. So probably that study needs to be done based off of a higher dosage of the omega-3s and the amino acid glutamine. But it is important that nutritional deficiencies be corrected for healing. Persons with inflammatory bowel disorders require as much as 30% more protein than normal. If chronic diarrhea is present, electrolytes and trace mineral deficiencies should be considered. Fatty stools resulting from improper digestion of fats may result in deficiencies of calcium and magnesium. Drugs such as corticosteroids and sulfasalazine, which are prescribed for inflammatory bowel diseases, and cholestyramine, which is prescribed to bind bile to the gastrointestinal tract to prevent reabsorption in people who had part of their intestines removed. Increase the need for nutritional supplements. Corticosteroids depress protein synthesis and inhibit normal calcium absorption by increasing excretion of vitamin C in the urine. Deficiencies of other nutrients such as zinc, potassium, vitamin B6, folic acid, and vitamin D decrease bone formation and slows down the healing. Antioxidants decrease a person's risk of developing Crohn's disease. The intestinal walls normally contain small amount of antioxidant enzyme superoxide dismutase, or it's known as SOD, catalase and glutathione peroxidase, but their ability to fight free radicals may be overwhelmed during periods of active inflammation that results from tissue damage. So depending on how bad you is, it may not help. To reestablish a proper healing environment, it is necessary to maintain a generally alkaline body pH greater than 7.0. So if you know anything about alkalinity, pH balance in the body, 7.0 is okay. Gotta go back again. My stand keep timing out, or the battery might be getting ready to die, and I believe the battery